A Washington state resident fell ill after returning from Wuhan, China.
The first case of the deadly Chinese coronavirus making its way to the U.S.
It started in China and is now spreading throughout the world.
More than 400 people have been sickened.
In New Orleans, police clearing iconic Bourbon Street last night.
900 confirmed cases.
Here in New Rochelle, they're setting up a 1-mile containment area.
We are only going to get on top of this outbreak if we know who is affected.
Schools and colleges are closing nationwide.
New York City Mayor Bill de Blasio reversing course, closing public schools.
As of today, their hospital had not received any test kits.
1.1 million tests have been shipped out.
This is certainly not a moment for panic or high anxiety.
The coronavirus
situation is evolving so rapidly.
They're worried. We've only received 2 test kits to date.
More than 125,000 confirmed cases.
Today, the World Health Organization officially announced that this is a global pandemic.
So while this new virus isn't something to ignore, all-out panic isn't warranted either.
The year is 2020. Donald Trump had just been impeached for the first time, and the 2020 campaign trail began, with candidates from across the political spectrum making their voices heard. In November, Joe Biden was announced as the 46th President of the United States, his Vice President Kamala Harris being the first Black woman to be elected to this position in United States history. The deaths of Ahmaud Arbery, Breonna Taylor, and George Floyd were being heard around the nation, Black Lives Matter protests sweeping the streets of America. And during all this, the talk of a new mystery virus was beginning to be discussed in global health circles. Restrictions were enacted, healthcare workers were pushed to the brim, and social distancing and isolation became a part of everyday life across the world. I feel like the pandemic affected all of us. The isolation, the screen time, staying inside all day, and the fear of not knowing what was going on. And according to healthinsights.com, these symptoms hit Gen Z the most, saying COVID-19 hit Gen Z during some of the most formative years of their lives, disrupting education, social development, mental health, and early career trajectories in ways that are still unfolding. Middle school is hard enough without having to worry how you were going to make friends if you never saw anyone in person, or looking out for family members that may have been more susceptible to a potentially fatal virus. As a member of Gen Z myself, I always wondered how the nation moved on so quickly. Staying inside all day for months on end is not good for anyone's mental health, and especially not a generation of chronic scrollers and hermits. So how did Gen Z cope with isolation? How did the most anxious, depressed, socially isolated generation in history deal with the pandemic? And how were they affected long term? That is what I set out to discover. Across a diverse range of students, freshmen to seniors, girls and boys, all different races and cultures, people had similar experiences across the board, creating a baseline for how almost 2 years of isolation from physical community and making connections can burn itself into the minds of a generation. Part 1. The before times. I think we all have nostalgia for the 2010s. Ushering in an era of skinny jeans and nylon cats, Gen Z was young enough to remember Frozen coming out, but not too old to feel the weight of the world looming over them yet. Tumblr and Vine were more popular than they would ever be again, and we were still as overstimulated as ever, but everything felt more fun back then. Your mom's iPhone 6 was a world of possibility, where you could play Geometry Dash World or Minecraft Pocket Edition until you got bored, and then go build a fort in the woods. Things were simpler, sweeter back then. A majority of Gen Z were children when the pandemic began, and some of these children encountered various adverse childhood experiences, most commonly abbreviated to the term ACEs. The term, coined by Vince Folletti and Robert Onda at the CDC, noted any sources of struggle in a child's life as an ACE, including physical, sexual, or emotional abuse, parental neglect, parental substance dependence, domestic abuse, and various other examples. The study found that there was nearly a direct correlation between the amount of ACEs someone experienced throughout their childhood and their physical and mental health in adulthood. I'm going to refrain from sharing any overly personal details from my dataset for the sake of the participants, but it is important to note that students listed various reasons for negative emotions even before the pandemic. Reasons such as clinical anxiety, the death of a loved one, general loneliness or neglect, and various other circumstances all contributed as reasons for feeling more sad and stressed than the average child. These anecdotes are also classified as ACEs. These kinds of traumas can lead to long-term chemical changes in a person's brain. Dr. Benjamin Suarez Jimenez at the Columbia University Irvine Medical Center writes how patients with PTSD can complete the same task as someone without exposure to trauma when no emotion is involved. However, when emotion invoked by a threat was added to a similar task, those with PTSD had more difficulty distinguishing between the differences. This shows how trauma can affect brain chemistry and lead to different reactions than those without trauma when emotion specifically is involved. In agreement with my poll data, students that wrote about having at least one ACE tended to mark being more susceptible to depression and anxiety during and after the pandemic than students that did not mention having any ACEs. While these accounts are all valid experiences, it is important to note that a significant majority of students did not feel this way. For many, being a child was free and happy. You didn't really have to worry about anything, school was easy, food tasted better, and life felt lighter. Before the pandemic, 73% of students rarely felt anxious or stressed, 65% had little trouble controlling worry, 67% felt motivated most of the time, and a whopping 80% barely felt down or depressed. When students were asked how they felt before the pandemic, this is what they said.
I felt happy. I rarely felt depressed. I felt like there was hope. Happy as a butterfly. I didn't feel depressed before the pandemic because I was 9 and I had not a clue of what that was. I used to play outside and do a lot of physical activities. I think I felt this way because I was active and confident in myself.
Now, there are many reasons that Gen Z was happier as kids, but one major reason was time spent playing, exploring, spending time outside, and making new experiences. A lot of students that had said they had good childhoods and good mental health cited going outside frequently.
It was good. I just grew up playing in the woods with my brother. That's pretty much all we did.
I spent a lot of times outdoors, which is not really my vibe, but, it's my mom's vibe, so.
It was good. I lived over by Sunnyside and I was playing outside a lot.
A study from 2019 cites how spending at least 2 hours outside per week can lead to long-term health benefits, including better breathing, longer sleep, boosted immune systems, and a better emotional and mental state of mind. Especially for children and adolescents, going outside lets you build community and relationships through shared experiences, common interests, and working together on a goal or project. Many studies, including one from the Lancet Child and Adolescent Health, cite how children's playfulness has been shown to have a central role in the formation and maintenance of friendships, which are of crucial importance for healthy social and emotional development. Playing and spending time outside is almost a guarantee that children will develop to be adults that are more socially aware, emotionally intelligent, and less likely to struggle with mental illnesses such as depression and anxiety.
I guess it was pretty good because I was raised distance from electronics, and then the only source of entertainment I had was just feeding animals, riding horses, and butchering sheep.
I'd say it was good, mostly because we went outside a lot, we did a lot of hiking, and ate a lot of food.
Spending time playing as a child almost always leads to students feeling less stressed and sad throughout childhood, and my data confirms this through the testimonies of those that were outside frequently. So most people felt pretty good when they were kids. Life was undisturbed and simple. That was until Part 2, bed rot. The Gen Z term for staying in bed for days on end binging on Netflix, TikTok, and Hinge. Hey man, where have you been these days? Sorry brother, I've been bed rotting. Urban Dictionary. This is how a lot of Gen Z spent their time during the pandemic, confined to the four walls of their room and scrolling for hours on end while pretending to listen to their teachers on Zoom.
I got all fat, and when I got COVID, I was asymptomatic and all my family was sick.
I'd say I would spend my time in my room almost every single day, you know.
There wasn't much else to do throughout the day than just to sit on my phone. Mm-hmm. And that really caused me problems because that would be the only thing I wanted to do every single day was scroll on my phone.
Bed rotting on the couch all day, I was eating a whole bunch of chips, playing Fortnite in uni.
I mainly watched YouTube Shorts because at the time, I got in trouble before that doing some things, and so my parents took away my phone, and so I didn't really have social media, you know, per se, but I had YouTube and Netflix and stuff like that.
Bed rotting can lead to malaise and a lack of motivation and is an early indicator of clinical depression. On the flip side, more bed rotting can lead to decreased motivation and overall negative emotional and physical side effects. Humans are creatures of habit. These periods of intentionally unproductive time can become a recurring pattern in your life, says Dr. Megan Galili, which was 100% a huge problem during the pandemic, as there was little else to do all day. When I asked students how the pandemic affected their mental health, one student writes how they lost physical contact with everyone they knew, saying how they were just sad and had almost no energy or willpower to do anything. And especially without school or activities to distract them, students that did not have a good support system and felt isolated suffered the most dramatically. The CDC cites multiple research studies that state how people that are lonely have an increased risk of heart disease and stroke, type 2 diabetes, depression and anxiety, suicidality and self-harm, dementia, and earlier death. So the loneliness faced during the pandemic could lead to long-term health effects. This was a very common sentiment throughout the pandemic, and no energy or willpower to do anything is a very common symptom of bed rotting and depression. During the pandemic, rates dropped to 33% of students who rarely felt anxious or stressed, 40% had little trouble controlling worry, 41% felt motivated most of the time, and 49% barely felt down or depressed. These rates show an average of 71.25% of students having no mental health struggles pre-pandemic to only 41% of students post-pandemic, showing a very significant drop-off in mental health during the pandemic. And of course, people were worried about their families. Over the course of the pandemic, over 1.23 million people died. Students that had lost family were afraid of it happening again. I just felt scared, I would say, and losing both my grandpas made me worry about who else I can lose. As a result, some took extreme precautions to avoid catching the virus.
My brother has cystic fibrosis, so if he got COVID, he would die. So we were all really scared, so we all never went outside.
My parents started really pushing it on me. We would wear masks and gloves and all that kind of stuff, even to just go into the store. And it would genuinely make me very concerned because we're doing so much stuff to be protected just to go to the store. It made things sound very extreme and very scary.
Especially without school or activities to distract students, having to deal with their thoughts became less of a luxury and more of a depressing inconvenience. One student writes,
I began to feel lonely with no power to be productive. Since there were no extracurricular activities to participate in, it made me feel so lumpy.
The majority of kids did not do anything during the pandemic because Zoom school was not a replacement for an actual learning environment.
I kind of felt like it was just a really long summer vacation because I didn't really do anything. We just went to online school. I hopped on Google and searched all my answers and didn't really lock in on school.
Going to school during the pandemic when we switched, It was just like a Zoom meeting once in March, and another in April, and another in May, and that was it. I didn't really keep up with school, because like, before 6th grade, I'm telling you, I was top of class, this and that. But then 7th grade, I didn't enroll in any school anywhere. 8th grade, I don't think I did either.
And this led to worse grades and more struggle with keeping up in school.
Pretty crappy. I almost failed just because I wasn't getting my assignments done.
These anecdotes are very important because extracurriculars are a high indicator of success and motivation in students, and multiple studies from the National Center for Disease Statistics write about how students that participate in extracurriculars tend to have better health and life outcomes and a stronger sense of community. It was very hard for students to stay motivated during the pandemic, and this led to learning gaps in many students' education. A study from the University of Chicago states how a majority of Gen Z, 65%, cite education as very or extremely important to their identity, and the pandemic is taking a toll on their education and career goals.
I did struggle a little bit in school because I'm not good with online learning. Again, I don't like it. I think it's stupid personally.
I pretty much just like not do the work. I would just kind of sit there online and play video games or watch YouTube and stuff, and it was just, I don't know, just kind of like being at home, just chilling.
I felt like I was falling behind, and I just was confused on a lot of things. So I kind of cheated throughout middle school, and I think that still affects me today, mostly because I kind of have a gap in Algebra 2 or Algebra 1, so I kind of like am a little troublesome in that.
It wasn't all bad though. Some students began to indulge in hobbies and interests that busy lives had taken away from them.
Started painting more.
We had a bunch of animals, like cats, dogs, and those cats kept my mind busy.
I was going on walks and stuff more often, and then I would either read, watch movies, or talk to my friends and game.
And many people made meaningful relationships online that helped them get through these difficult and lonely times.
During COVID, for some reason, I just hopped online and I was just talking to just random strangers online.
I made a lot of friends on Zoom, which was like the online sort of thing, but I made one of my friends, he goes to the school now, his name is Bo. We would just chat and play video games together, so that was pretty cool.
Mostly, I've had a really strong relationship with my friends online because that was the only way we really connected.
Getting friends online, I felt like it helped a little bit.
Separately from school, off Zoom, you guys talk to them on Discord or on messages.
This helped with loneliness a lot during the pandemic, as it gave people an online community where they could talk to friends when things got hard. My anxiety during the pandemic wasn't that bad because I wasn't seeing anybody. All of these experiences and challenges during the pandemic, good or bad, shaped the mindset of students long term. The National Library of Medicine conducted a study examining how Gen Z's resilience and openness to change was impacted by the pandemic. The study says how Gen Z members had higher levels of openness to change and self-enhancement as compared to Generation X. It also says how Gen Z were found to be more positive in their attitudes towards flexible learning. This study claims that the experiences of the pandemic, while difficult for everyone, may have led to more happier outlooks on the world long-term across a generation. Even though the pandemic was hard,
it was just kind of a setback for everyone.
A lot of people were losing jobs, and I guess it was just a really stressful time,
I don't know, I just really distanced myself, so I just never really talked to anyone ever because I was scared of everyone and everything, so.
There were some good things to come out of it.
Obviously I talk online and I felt like I could be more of myself. I feel like just because I was experiencing and exploring my hobbies so much, it didn't affect me so much in a negative way.
I didn't really have the feeling to be alone.
Gen Z's pandemic experiences help us to better understand why mental health is impacted to this day, in the short term and the long term. Part 3. Homecoming. Going back in person was weird. Super weird. After staying inside for almost a year, seeing people that weren't your family was kind of a culture shock for everyone. Some people had a great time going back in person. but some people didn't. For some, talking to people was a breeze after being in quarantine for so long.
It didn't really impact me that much because I was still able to just talk to people.
That was pretty normal. I think we still had recess and stuff, that everyone was wearing masks and just like following the protocol of the school.
My mom said that she didn't really want me to go, but I wanted to go because I wanted to like make those connections with new people and stuff.
But for others, it had never been harder.
I think I had trouble socializing with other people. We did have trouble like opening up to other people and like, yeah, just like talking, I guess.
With me, it was just like me, myself, and I on my phone. Like, I was enjoying that. I was chill with that.
Understanding the direct aftermath of the pandemic is much easier to grasp than the long-term impacts. So let's just start with that. According to my data, 39% were not anxious or stressed most of the time after the pandemic. 43% were able to control worrying most of the time, 40% found an interest in doing things, and 42% almost never felt hopeless or down. While rates of anxiety permanently went up during the pandemic, when the government raised quarantine restrictions, anxiety symptoms in my poll reduced by about 5%. The vaccine coming out and the realization that everything would be okay was a huge contributor to these outcomes. A study from PubMed Central says how unpredictably induced contextual fear and chronic expectation of potential threats increase anxiety. And with the virus more under control than ever through means of the vaccine, anxiety decreased in the sample as a result. Students said,
I was happy it was over, and it was a relief getting the vaccine. The feelings lessened because all my friends and family were getting cured.
Anxiety also went down because people were excited and happy to see their friends. Isolation during the pandemic led to less community and therefore increased anxiousness. A study from the American Medical Association found that loneliness can lead to chronic adrenaline and cortisol spikes, resulting in that anxious feeling. Cortisol is the hormone produced by the body to help regulate feelings of stress and anxiety, producing more when the body is highly stressed and less when it's feeling normal. Cortisol rates went down slightly after quarantine was lifted, according to PubMed Central. Students said,
I felt less depressed because I could see and interact with people. After the pandemic, I was relieved. I was able to see my friends again, and they made me happy.
I made a lot of new friends. I had a bunch of new experiences, new school, bigger environment to be around, I guess. I don't know.
Also, school made more sense. Things were easier when a teacher was actually there to motivate and explain things better and in more detail. And the environment of an actual classroom let students thrive in ways that online could never dream of.
I remember that being easier just because it was easier just to get school done in person and just having people around you.
However, many students did not feel this way. Many struggled to socialize and transition back into the world after the pandemic. There was a kind of whiplash from not seeing people for over a year and then being thrown back into society.
I want to say that was 6th grade, and that was the time that my mental health was at the lowest it's ever been.
When I did go back, it was just kind of I was saying stuff, but then people didn't really like it.
I was mainly getting more sad and stuff and just not in the greatest mind space.
It was difficult for students that had stayed mostly to themselves during the whole pandemic.
I felt like because I had gone so long without true human interaction, it amped up my social anxiety for certain situations.
I would prioritize being on my phone more than anything else, such as doing my schoolwork or interacting with people.
And it was hard to deal with complicated social and emotional situations.
And the administration there was not the best. They were really sexist and stuff. So I would always pretty much get picked on by teachers and stuff.
My grandma dying, my brother being sick, my dad being a piece of shit.
The staff members there, they engaged so much in nepotism, and their administration was embezzling money.
And I was going into a new school with new rules, new teachers. I didn't know the layout.
How the pandemic had various short-term effects that immediately caused some form of anxiety and depression for more than half of the poll respondents. The main cause for most of these symptoms was inability to socialize and make friends. The problem with trying to measure sociability is that there's not really something that can be measured. Sure, you can ask students to rate on a scale of 1 to 10 how outgoing or shy they think they are, but it's really hard for students to know what's a 1 and what's a 10, as everyone's experiences in the world are different. For this reason, I will mainly be using anecdotes from students that felt echoing effects, as when I was reading through some of the responses, it genuinely shocked me how many students were negatively impacted long-term by the pandemic. So here I created a Google Doc with all the responses of students talking about how their feelings of anxiety and depression were impacted after the pandemic. The writing highlighted in green is for people that felt the same, if not better, after the pandemic. The yellow is those who felt somewhat impacted, and the red is those who really struggled and were affected long term. As you can see, a slight majority of responses are yellow and red. Here are some of the things that students said. I didn't have anxiety, but I started developing social anxiety because I barely socialized to anyone that wasn't my family. My anxiety skyrocketed because I essentially forgot how to socialize. Other than that, my anxiety disorder got worse with no treatment, so I had to go to counseling. I would describe my feelings of anxiety after the pandemic as highly increased and everlasting. It seems as if my anxiety never stopped skyrocketing at any news information after the pandemic. It was hard to build more connections after not seeing people for a while, which was worse than the actual pandemic itself. Students also felt more judged than ever, and some even felt more bullied.
I was just generally a depressed and anxious person afterwards. I didn't want to talk to anyone or make any friends. I think I felt like this probably because I was isolated from my peers and exposed to online negativity for so long.
I felt very self-conscious about everything and self-centered because COVID made me rethink a lot about myself.
Yeah, I feel like yes, in like the beginning, it was very easy to transition from being at home to being in school. But then I guess like after a while, when the pandemic started going away and stuff, that I guess people were just like, oh, like they saw like, they were just like, oh, like that's kind of weird. And like they shifted their perspectives and like they were just like, oh, like that's not really what we're looking for, you know?
Students were without a doubt deeply impacted by the pandemic in ways that affect them still to this day in 2026. A lot of people, including those in Gen Z, like to say how
the pandemic was over years ago. People need to get over it and stop complaining.
But what I think my data clearly shows is that people are still impacted by COVID to this day. Now, in saying all this, Gen Z has not given up completely on their mental health. Just because we went through a life-altering event that has remnants of itself pasted everywhere in our world, our media, our minds, that doesn't mean that we should give up hope. We cannot change our predicament, but we can change our response. We can continue to live with the unfortunate circumstances that impacted our generation and move on despite the current state of the world and what happened in our past.